welcome to the Instagram live broadcast from Pelvic Rehabilitation Medicine. I'm Dr. Leishear. I'm in Birmingham, Michigan, so right outside of Detroit. So if there are any people from the Midwest, please let me know, and I'm just gonna wait for people to join. But I'm excited to talk about fibroid pain and some of the treatment options as well. Hello. Thank you so much for joining. Can't believe it's already September. I feel like the summer went by so fast with everybody. It's been an unusual 2020 year, obviously, but hopefully everybody's has some support and reducing your stress as much as you can and getting regular exercise, walking. If you could reach out to friends and family, maybe a Zoom hangout or FaceTime, that's very helpful. It's always helpful to have a good support network. Hello everybody. I would love to hear if anybody is interested in anything specific about fibroids. We're just going to go over the what are fibroids, what are the symptoms, how common are fibroids and who is at risk, and some of the risk factors, how it's diagnosed, and what are some of the treatment options, including non-surgical and some surgical if needed. And also what physiatrists, I'm a physiatrist, if you are familiar with that. The other name is Physical Medicine and Rehab doctors. So we're really focused on function, really getting you to the best level of function as possible, and also to increase your quality of life. So really focusing on that as well as the muscles and nerves. So really focusing on pelvic pain, we really try to focus on the muscles and nerves especially, but really trying to just have an interdisciplinary, holistic approach for treatment, because it can be a complicated problem and we really use all the tools available. Just gonna wait a little bit longer for people to join. Let me know if you want to know. Let me know where you're from and where you're joining us from. That would be great. I hope everybody's having a good early September so far. I know fall is probably my favorite season, so I love when the leaves turn and just a beautiful time, a little bit cooler. Hello everybody. Thank you for joining. Just gonna wait a little bit longer. We'll get started in a little bit. Hello. Thank you for joining. Thank you for taking time out of your busy day to join me. Minneapolis, great. I've never been there, but I want to go. And we're lucky outside of Detroit to be really close to, not far away from Chicago, not far away from Toronto and Pittsburgh. I did my residency in Pittsburgh, so I really love Pittsburgh. Good sports there, good supportive sports too for such a small city. You like hockey and football. Hello. It looks like people are joining. Again, we're just going to go over what fibroids are specifically, the symptoms, how common are they, the risk factors, and how they're diagnosed and what you can do for treatment. So thank you for joining. I think we'll get started now. If anybody has specific questions, please let me know. And so what are fibroids? Fibroids are benign tumors. They're located in the wall of the uterus, and specifically the muscle layer, the smooth muscle layer, and the most common benign uterine tumor. So they're responsive to hormones estrogen and progesterone, particularly estrogen. So when these hormones are around in a higher level, such as pregnancy, then the fibroids tend to grow. Thanks for the love there. And when the hormones are around in a lower level, then the fibroids tend to shrink. So such as, after menopause, the hormones are around in a lower level. So the fibroids tend to shrink. And they can really vary in all different sizes. They can really be as small as a pea, or they can be as large as a cantaloupe or even larger. And they can vary in shape and location. They can change the shape of the uterus. And, as far as location, they really can be anywhere in the uterus. So they can be higher up near the top of the uterus. They can be lower down, lower part near the cervix. And the location, they can be in the muscle layer itself, so that's called intramural. They can be under the inner lining of the uterus, that's called submucosal. And they can also be under the outer lining of the uterus, so that's called subserosal. Sometimes they can grow on stalks, either inside or outside of the uterus. So what are the symptoms? So you can have heavy menstrual bleeding, heavy periods, and the periods can last a long time, 7 days or more. You can have bleeding between periods. You can have just severe pain or cramping during your period. Sometimes if the fibroids are large enough, they can cause abdominal discomfort or distension. You can have pelvic pain or pressure. They can put pressure on nerves in the pelvic area. They can also put pressure on organs in the pelvic area. So if the fibroids are located in the front of the uterus, the fibroid can put pressure on the bladder and cause urinary symptoms. So urinary frequency, having to go often, urinary urgency, having to get to the bathroom right away, urinary incontinence, leaking of urine. Sometimes you can have difficulty emptying the bladder. If the fibroids are on the back of the uterus, then they can put pressure on the end of the colon, the rectum, and it can cause constipation sometimes. You can have back pain. You can have pain with intercourse. You can have infertility sometimes due to fibroids. You can have complications during pregnancy, including miscarriage. And you can have secondary pelvic floor muscle spasms and guarding of the pelvic floor from fibroids. Now, this can happen with other gynecological etiologies as well, such as endometriosis, adenomyosis, ovarian cysts. So a lot of different things, just because of the close proximity, can cause guarding of the pelvic floor or pelvic floor muscle spasms. And also pressure from nerves, different nerves in the pelvic area can also cause pain. And we really, the doctors at Pelvic Rehabilitation Medicine really want to manage your fibroid pain and put you on a path to finding relief. So if your fibroids haven't been addressed specifically before you come to see us, then we can bring other specialists in to help, especially if more invasive treatment is needed. What are the causes? So the cause of fibroids are really unknown. It's thought to arise from the muscle layer, the smooth muscle layer of the uterus. They're responsive to the hormones estrogen and progesterone. So when these hormones are at a higher level, particularly during pregnancy, the fibroids tend to grow. And then when the hormones are decreased, such as after menopause, the fibroids tend to shrink. And the cause is probably multifactorial, meaning a lot of different factors interact to develop and grow fibroids. How common are fibroids? So they're pretty common. They're about a third of women of childbearing age have fibroids, and up to about 80% of women, all women, have fibroids. African American women are about 2 to 3 times more likely to develop fibroids. Also, if you have a family history of fibroids, you're at a higher risk. So if your mother has fibroids, your aunts have fibroids, you have a higher risk of developing fibroids. About half of all hysterectomies are done related to symptoms due to fibroids. Also, obesity may be a risk factor associated with fibroids, as well as alcohol and red meat. How are they diagnosed? They're usually diagnosed by a gynecologist on a pelvic exam if they're large enough, and usually an ultrasound is used to confirm the diagnosis. An MRI can also show fibroids. If you are going through infertility workup, they often use special imaging of the uterus as well as the fallopian tubes, but the fibroids can be picked up on that as well. So what's the treatment? It really depends. If you have fibroids, you're diagnosed with fibroids by your gynecologist or another specialist, and you really don't have symptoms. You don't have heavy menstrual bleeding. You don't have severe pain or cramping during your periods, no pain with intercourse, no urinary symptoms, urinary frequency, urgency, or constipation, or other bowel symptoms, then there's really nothing urgent that needs to be done necessarily. So it's usually just watchful waiting, and your gynecologist usually will just monitor the growth through ultrasounds. And also monitor your symptoms. So if you weren't having symptoms, but then you develop symptoms, then maybe something is needed. But if you're having symptoms with fibroids and you're having the heavy bleeding, bleeding between periods, pain and cramping with periods, the pain with intercourse, the urinary and bowel symptoms, there are things that can help. Medications such as anti-inflammatories, so NSAIDs or ibuprofen, naproxen are some examples, but that can help with the pain. But it also decreases a chemical made by the uterus that actually promotes cramping. So the chemical is prostaglandins. It's made by a lot of tissues in your body, but it's made by the uterus and promotes cramping. So the idea is if you take the anti-inflammatories, that you can decrease the level of prostaglandins, you can decrease the cramping and decrease your pain. The other medication that's often used are hormone therapy that usually gynecologists can really direct you on, with using estrogen, progesterone, different combinations of those, and they can come in a variety of different forms. So really pills, injections, IUDs. So the idea really is to make your periods lighter and less frequent. That can really help with your symptoms, the bleeding symptoms and also the pain symptoms, the cramping. And there are other options as well. Sometimes you could do an embolization of the uterine artery, which really cuts off the blood supply to the fibroids, and the fibroids can shrink. There are also other surgical treatments if needed. So you can have a surgical removal of the fibroids called a myomectomy. Also, you can have a hysterectomy, which is the surgical removal of the uterus. And pelvic floor muscle dysfunction and chronic pelvic pain can really be triggered by fibroids as well as other gynecological etiologies. But our unique approach with the doctors at Pelvic Rehabilitation Medicine can really help manage fibroid pain and really get you on the path to finding relief. You know, it can be very stressful having pain in general, pelvic pain, undiagnosed pain, so that can bring a lot of stress to your life. And also, it can really decrease your level of function. It can decrease your quality of life. So our goal, especially as physiatrists, as rehab doctors, is to look at getting your level of function to the optimal level, increasing your quality of life, specifically looking at muscles and nerves, but really treating the whole person, holistic approach, interdisciplinary. Again, if we need to have other specialists brought in, we will definitely do that, because this is a complicated problem. It's really, what is the best treatment plan for you? And there are some things that you can do just even right now to either reduce your risk of getting fibroids, or if you have them, you can incorporate these things to slow the growth. So really, basically, healthy lifestyle. Getting a healthy lifestyle, healthy diet, good sleep is very important, stress reduction, regular exercise. So it's really important. All of those things are important for a lot of different reasons, but it really can help with not only fibroid pain, but pelvic pain or chronic pain in general. And the diet I usually talk to my patients about is an anti-inflammatory diet, very similar to a Mediterranean diet. So very plant-based diet. If you could do mainly plants, that's great. If you can limit the animal products, especially meat and even dairy products. Dairy products can be pro-inflammatory, as well as sugar and gluten sometimes, processed food, staying away from processed food. So food really is medicine, so that can be a basic thing to start with. Again, really, this is something you can incorporate, but please check with your doctor whenever you make dietary changes to just make sure that diet is right for you. If you can eliminate or reduce red meat, processed meat, that would be wonderful. And, incorporating a lot of vegetables, green vegetables, especially green leafy vegetables, is important, and it can be detoxifying for the body. Maintaining a healthy weight is important. Decreasing alcohol. And sometimes green tea can be helpful. It's anti-inflammatory, and it can, especially talking about fibroids, which is really promoted by hormones, particularly estrogen. So green tea actually has been shown to decrease estrogen in the body. You can also limit foods that mimic estrogen in the body. There's not a lot of great research on this, but there's been some studies that have shown that limiting foods that mimic estrogen in the body can help. So such as soy products, soy milk, tofu. Some of those, soybeans, tofu, it's healthy for a lot of reasons, but if it could affect fibroid growth. And just stress reduction. And this is, for everybody, obviously this year's been very stressful. So at times it can be difficult to manage stress, but anything you can incorporate into your life for stress reduction is super, super helpful. So relaxing yoga, mindfulness meditation, diaphragmatic breathing, most, pelvic floor physical therapies will actually go through breathing, meditation, stress reduction techniques that actually really help in pain, because it calms down the nervous system. And so it calms down that upregulated nervous system in chronic pain. So very, very helpful. And cognitive behavioral therapy is very helpful. Another tool that we use for our patients. We are lucky to have a CBT, or cognitive behavioral therapist, Dr. Scrivani at PRM, and we use her a lot actually. So this is very helpful for a lot of things, but especially in pain, chronic pain, pelvic pain. So if you're not familiar with cognitive behavioral therapy, it is really just looking at things that you can control, things that you cannot control, and really how to deal with the things that you cannot control. So really can be helpful in a lot of different areas of your life, but specifically pelvic pain. Also, acupuncture can be helpful to decrease your stress and to relax your body. A really good acupuncturist should have you falling asleep on the table, so really relaxing and calming. Also regular exercise, so any regular cardiovascular exercise, any, especially walking is very good. Can I prevent uterine fibroids? That's a great question. Yes, I mean, there's definitely a risk for family history. So there are things that you can't change. So if you have your mom and your aunts or a lot of females in your family have uterine fibroids, then your chance is greater. But some things that you can do is maintain a healthy weight, because obesity is one of the risk factors. Also, avoiding red meat, processed meat, more of a plant-based diet can be very helpful. And those are the basic ones. Really just lifestyle, the diet, plant-based, avoid, if you can reduce or limit alcohol, red meat, those are the big ones. Anything that, and the foods that may promote development or growth are particularly foods that mimic estrogen-like substances basically in the body. This is soy products. Try to limit that. Soy milk, soybeans, tofu, that kind of thing. Great question. And can endometriosis recurrence be avoided? Great question. Thank you for the question. So, unfortunately, to my knowledge, it cannot. The best way, obviously, the endometriosis is difficult because you can only, to diagnose it, you really have to have surgery and a biopsy. And really to get relief from it, you need excision surgery. So you need to remove the endometriosis. And sometimes people will burn the lesions, endometriosis ablation, but it really doesn't get to the root of the endometriosis. And sometimes the endometriosis lesions can grow back. So I would say that at excision, if you're going to have the surgery, excision is really the best outcome, the best long-term relief. As far as, it really depends. That's why it's really important to have a good endometriosis excision specialist that really has a specialty in endometriosis excision surgery. So because they have to know what to look for, and they have to look at a variety of places. So if they only really look in the reproductive area, they might miss endometriosis, because it really can, even though the most common area is right around the reproductive system, it can be up to the diaphragm, it could be in the bowels, it could be vaginal, it could be on the wall of the abdominal wall. So you really have to have, really depends on also how good the surgeon is. If you've had the endometriosis excision already, does recur sometimes, but if you have that, great excision, really extensive, I know it can be really tough, with the surgery sometimes, but really making sure you get all of those inflammatory lesions out is really the best chance that you have of it not being missed. It really can come back. You can have new lesions, but really it's really important to just get all of the lesions that are there. Oh, so surgery for it, yeah, it's tough, and it's especially if you could do it minimally invasively, but if really the best way is to look in a lot of places, then it's going to be, you're going to have recovery after. You want to make sure that it's well taken care of, that it's removed, but you really have to look in a lot of places. So it can be tough. Oh, I'm sorry. All right, 9 surgeries and a hysterectomy. Yes. Oh, thank you very much. And, I think hopefully we're getting better in 2020 with endometriosis, and not only the diagnosis of it and, but also the treatment, the surgery, because you're welcome. And because, a while ago, and not that long ago, and there's some specialists who still feel this way, but a lot of times if, you're having symptoms that may be endometriosis related or suspected, then, the cure is a total abdominal hysterectomy, take the tubes and ovaries out, and you won't have endometriosis anymore. And we know that that's not true. While it may be helpful for a lot of people where they only have endometriosis in the reproductive system, a lot of times there are lesions that are just missed. So hopefully we're getting better, and especially being involved in pelvic floor, especially women's health. I'm very passionate about really getting that word out to primary care physicians, OBGYNs, and patients really. So, thank you guys so much for joining. I appreciate it. Thank you for all the love and the thumbs up and the questions. I'll try to go back. I'm sorry if I missed any. Let's see. Yeah, anything about fibroids, anything about, or anything about pelvic pain in general, I would be happy to answer. Okay. I think I'm pretty caught up, but let's see. Yeah, inflammation and endobelly, including digestive issue, yes. And that's pretty common. A lot of people will have GI symptoms, and people will say, well, maybe it's not endometriosis because maybe it's GI, or a common diagnosis is IBS, and really GI constipation, diarrhea, sometimes fluctuating, can really be endometriosis, and especially if they get worse with periods, but it doesn't always have to be. That's a lot of times it's missed because it's really not cyclical. It doesn't worsen with periods or get worse at a certain time of the month. So it can be really hard. I'm sorry you're going through that. Yeah. Excision was not known. Yes, years ago, excision was not known to ducts, only ablation. So hopefully we have more research. Yes, I agree. We're moving forward. You're welcome. There. I think I missed the beginning, but fibroids are hormonal and inflammatory driven. Oh, you're welcome. So yes, so the fibroids are mainly hormonal. So if you kind of missed the very early beginning of my talk, so benign tumors in the uterus, the wall of the uterus, the muscle layer. I really don't know exactly what causes it. If it's just an uncontrolled growth of muscle cells, specifically the smooth muscle cells. And it's responsive to hormones, estrogen and progesterone. So when the body has a lot of these hormones, reproductive years, especially pregnancy, these hormones jump up. So the fibroids tend to grow at that time. And when the hormones are at a lower level, such as after menopause, the fibroids tend to shrink. So yes, driven by hormones. That's why sometimes the hormonal therapy, estrogen and progesterone, can really help. It's a hormonal suppression, if that helps. The inflammatory, if the fibroids can trigger inflammation in the body, it can trigger muscle spasms, it can trigger nerve inflammation. So, the reason why I recommend the anti-inflammatory diet is really it's helpful for reducing your risk for fibroids, to decrease the red meat, that kind of thing, your plant-based diet. But also just inflammation in general. So inflammation you can have from other gynecological etiologies as well. So more so probably with the endometriosis, but fibroid pain can trigger inflammation as well. Welcome. Good. Yes, and sorry if I missed your question, please send it again. So really, I hope that was helpful for everybody. Is an endo also? Yes. Endo is definitely an inflammatory disease. And that's why, so really getting those inflammatory lesions out is important. But endometriosis is really tough to diagnose. You have to have surgery to diagnose it. But even the symptoms can be vague, sometimes. But I'm sorry about that. So yeah, endometriosis is pro-inflammatory, so those lesions are pro-inflammatory. But some people have a lot of lesions, will never have pain, and some people have a few lesions and will have a lot of pain. So it really doesn't correlate very well to the extent of the disease, and that makes it difficult too. But yes, especially endo patients, I always talk about anti-inflammatory diet. That's why anti-inflammatories, NSAIDs, really work well with endometriosis. So we use suppositories a lot for treatment, muscle relaxers. But especially if somebody has endometriosis, sometimes we use an anti-inflammatory in the suppositories. We can add other things if needed, but sometimes people with endometriosis who have a lot of pain during their periods, they can have the muscle relaxer suppositories to take at night, and then they can have another set of suppositories, the anti-inflammatory suppositories, to take when they need it, when they have a flare or when they have their periods and their symptoms increase. Great question. Okay. Do you think urinary urgency is mostly nerve pain after orgasm? Or hormonal or muscular? So the urinary urgency as it pertains to fibroids, usually it is because it's the fibroid is located in the front of the uterus and really puts pressure on the uterus, or I'm sorry, the bladder puts pressure, the fibroid puts pressure on the bladder. So that's what happens. It's really pressing on the bladder. So you just have that urgency. It's almost like it's forcing the urine out almost, that you really have to get to the bathroom quickly or else you're going to lose it. And sometimes the urgency too can be really the pelvic floor muscle dysfunction. So you can have that. You can have a combination. You can have a pressure by the fibroids on the bladder, pushing the urine out. And then if you have the pelvic floor, really is the outlet, so where the urine has to pass. So if you don't have a strong enough pelvic floor, then it's actually going to let the urine leak. So you can have incontinence, you can have urgency. So great question. It could be, definitely the urgency could be multifactorial. It can be nerve related as well. So I talked about the nerves in the pelvis that are overly sensitized over time with chronic pain. So the nerves actually can, especially with urgency, what normally maybe you have a larger amount of urine that signals the body, okay, I need to go to the bathroom. But when those nerves get sensitized, you have that urge to go to the bathroom with a small amount of urine. So that's a really good question. So it's really about oversensitization. So really it's a lot of different things. So it can be the pressure, the physical pressure on the bladder. It can be the nerves and muscles too. Great question. Okay. All right, just trying to make sure I got everybody's question here. Okay. Also wondering, Sibo interacts with urinary urgency. Thanks for all your help. You're welcome. And Sibo, that's interesting. I don't know if there's a lot of research or a lot known about it. I know that it's important to recognize and to diagnose. I'm not too familiar with, it's close to that area. The colon is close to the bladder, and so it can possibly affect the nerves, but I just don't know for sure. But it definitely makes sense that because of the close proximity of all of those organ systems, that could irritate nerves, and one organ system can actually affect the other. And that happens a lot of times with pelvic floor muscle dysfunction, where you have the bladder, the vagina, the reproductive system, the colon, all in close proximity. So the muscles and nerves talk to the other organs. So whether it starts in an organ system or the muscles and nerves, they can really irritate each other and cause issues. After surgery, if we keep the inflammation under check, will that help delaying recurrence? Okay, so you're talking about the endometriosis surgery, is that right? Yeah, so there are a lot of things. So after surgery, it's important to really treat the muscles and the nerves, which is what we can really help with. So a lot of times after surgery, whether it's endometriosis surgery, fibroid surgery, we usually will have people, you can come and see us, but with our treatment plan, really working on the muscles and the nerves, really 8 weeks post-op, just because you need just time to heal surgically and from the surgical pain. But definitely, incorporating any of the lifestyle modifications, diet, exercise, obviously when you're cleared to after surgery, stress reduction, good diet, then we really can help. Pelvic floor physical therapy is going to be one that's going to be very necessary, all is pre-surgery and post-surgery can be helpful, because whenever you calm down the muscles and nerves before surgery, you're going to have a better outcome, but definitely after surgery too. Yes, so pelvic floor physical therapy, the suppositories can be really helpful, relaxing that pelvic floor, because after you've had the endometriosis surgery, just because of the surgery, everything that you've gone through, the pelvic floor muscles can be tight, short, spastic, and weak. Also, the nerves can still be irritated. So that's really where we can really help, after, especially start, 8 weeks post-op with our treatments. We do ultrasound guided external injections that really complements a multimodal approach, really with the suppositories, the pelvic floor PT, to really lengthen the pelvic floor muscles, to decrease the nerve inflammation, and to open up the space around the nerves to heal themselves. So yes, that's a very, very important part of the treatment, especially after surgery. Thank you for the question. Oh, great. Thank you so much. Yes, endo. Okay, great. Perfect. Hopefully that answers your question. And again, the lifestyle modifications are really just helpful anyway, but really helpful for pelvic pain. Okay, if there are any more questions, I'd be happy to answer them. Thank you. Lots of love. Thank you so much. Oh, anytime. My pleasure. I hope that was helpful for you guys. Again, we really want to develop a treatment plan that's going to be helpful to you and get you back to things that you love to do and manage your pain. So that's great. Thank you. Oh, thank you, Susan. Hope you're doing well. Well, thank you so much. It's been a pleasure. And, again, I'm Dr. Leishear. I'm in Birmingham, Michigan, outside of Detroit. Please, please visit me or at the other locations. If you're around, Michigan, come to me. Oh, we have one more question here. So, do you find muscle relaxants better vaginally or rectally? Great question. So I usually tell my patients, my female patients, obviously, the suppositories, the muscle relaxant suppositories, you can use it vaginally or rectally, just whatever's gonna give you the most relief. Sometimes if people are having more vaginal pain, it's gonna probably work better vaginally. If they're having more posterior or rectal pain, it usually works better rectally. So it really just depends. You can really just use, either way you'll get to the pelvic floor muscles, but good question. I really leave it up to the patient. And sometimes the suppositories, and maybe they have more rectal pain, but they're really having difficulty or more pain inserting the suppository rectally, then just start vaginally. The same thing with pelvic floor PT with internal work. If you have more rectal pain that really does need rectal internal work, starting with vaginal work will hopefully decrease your pain, decrease the tightness, and eventually you can get to rectal internal work, and eventually you can get to the rectal suppository use. But great question. Thank you. Great. Hello. So thank you so much for joining. I really enjoyed my time. Thank you so much for taking, please reply to okay, I will. And, thank you for joining. Thank you for taking time out of your busy day today to listen to me speak about fibroid pain and just pelvic floor muscle dysfunction in general. So definitely, we'd love to see you in the office. We have different locations all throughout the country. We'd love to get you some help. All right. Take care. Be safe.